Greetings for on the occasion of World Heart Day. The World Heart Day is celebrated to create awareness amongst the people about the cardiovascular diseases. Cardiovascular diseases is one of the major components of morbidity and mortality throughout the world. It accounts for about 31% of total fatalities which occurs around the world. Over the years from 2010 to 2019, there is a increase in the cardiovascular problems, 50% of which, or more than 50% of which, is related to acute coronary syndrome. That is what we usually know as heart attacks. So, what we can do to prevent that first from going, because today you find that there are a number of youngsters, young population who are getting cardiovascular diseases along with the heart attacks. We come across daily such cases. So there are few things which we can do. Culprits being hypertension, which needs to be controlled, sugar, which needs to be controlled, the diet habits needs to be changed, the regular exercises needs to be done, avoid tobaccos and alcohol, take care of hypertension and diabetes in case you have one, and the most important is you may get certain symptoms. The symptoms may be related to the heart, which we come across usually. They are chest pain with radiation of pain to the limbs as well as to the jaw. There could be a shortness of breath, giddiness, sweating, vomiting, lightheadedness, uneasiness in the chest. If you have any of these symptoms, don't take those symptoms lightly. You don't attribute this to something which you have heard. Please go to the hospital. If there is a hospital with a facility for cardiovascular system examination as well as specialist available, please go to that hospital. In case there is such hospital or the specialist is not available, go to the nearest hospital where you can get the primary treatment, including ECG, which would be done. There are certain medications which needs to be given immediately. In case there is a presence of aspirin in the house and you don't have any allergy to aspirin, or there is no upper GI bleed, that is, there is no bleeding tendency or there is no ulcer, history of ulcer, you may chew one if you start having symptoms and reach the hospital, so that by the time the aspirin starts working, once you are in the hospital, the emergency department would assess you, and probably you would require to get admitted for 24 hours. Before they can discharge you, you may be in observation, and in case you have something which is related to the heart attacks or what we call as acute coronary syndrome or STEMI or non-STEMI or unstable angina, whatever, they would give you certain medications as well as certain procedures needs to be done, which probably would save your heart from going into poor condition. So whenever the doctors or the emergency would advise you, please follow the instructions, and after you get corrected and go back to your home, please follow the instructions so that of the medications which have been asked to you to go ahead with throughout your life. Probably you need to follow that on a regular basis. Avoid those which can harm your heart. Take control of your weight. Do the exercises when the doctors would ask you to after you have already had a heart attack. And I hope all these parameters would right from prevention to cure can be done. And we wish on the World Heart Day that you remain healthy and be with your loved ones at your home. Thank you.